So today we're going to be going over intermittent compression, and this is my dummy Manny who is recording. So first off, we will be doing this because it'll increase lymphatic flow, help increase range of motion, prevent deep vein thrombosis. So let me just explain this a little bit. So there are two types, well, there's a few types, but we're going to talk about the two. So there's a 6-prong, I don't know if you guys can see that. And then there's a 3. We only have the 3 here. There, that's better. And there's our machine back here. It's really basic. All it has is an on and off, and then the pressure. And usually you want to go by the diastolic. Excuse me. The diastolic pressure of the athlete. But here we don't really have anything, so we're going to hook it up and explain some of the sleeves. So there's quite a few sleeves, but we only have 2 here. This is the arm one. There's a full leg one, and then there's this little leg one. We don't have a full leg one, but we will be using the arm one today. So first off, you're going to explain to the patient where we're going to do this, introduce yourself, modesty, make sure that they're okay with it. You want to ask them to remove their jewelry. Ask them if they have any contraindications, which I will get to in a second. You want to hook your machine up, get it to all the right parameters. You want to set the temperature if you have one, which would be like cryo cuff or game ready. This one just basically just does air, oxygen, and it fills up from distal to proximal. You will ask the patient to put it in. It's going to be a little bit, and then you want to make for sure that they're totally okay with it. You will have your parameter set and then start it. So the indications why you would use this is for swelling and edema. You wouldn't use this, the contraindications, if they have cancer, bone fractures, acute pulmonary edema, deep vein thrombosis, congestive heart failure, excuse me, obstructive lymphatic or venous return, peripheral arterial disease, and skin infections. The precautions are impaired sensations, uncontrolled hypertension, stroke, and super peripheral nerves. So once this is all going, you have their parameters set, their on and off time, which would be like once it's fully like expanded, it'll be like you could do like 30 seconds on, 30 seconds off, or up to a minute, minute on, a minute off. You want to keep checking them, making sure that their capillary refill is okay. Tell them sometimes it's okay to like do like little distal phalange exercises just to keep the blood moving. Sometimes you want to, actually most of the time you want to have it above your heart, so elevate it a little bit. And then once the treatment is over, this one doesn't take all the oxygen out, so you can just kind of take it out, make sure that you're be careful. Plug it, remove the air. You want to check if they have any if they have any discomfort or constriction. Check bilaterally if they have any sensation, like impaired sensation or anything like that, any tingling. And then after that, you are free to go on to your next therapy. That's all. Thanks.